from the second group, very thin penetration towards the dentin and towards the filling. This is the high-speed drill group. You see the cavity is flat because of using the burr. It's T3, so it's third sample of the turbine group. But there you can see what huge amount of micro leaching, almost reaching the pulp, but it's because it's so thin enamel, we are less again the 1 millimeter, but maybe this will be in the group with the more than 1 millimeter micro leakage, but it's not so important because we search for the samples without any micro leakage, and this is with 2 or 1+ is not so of big importance in the control group. This is again from the turbine group. The control, you see the micro leakage here. These are 2+ because it's getting really in the pulp chamber, and the coloration of the filling is until the middle of the filling. You see the half of the volume is colored. Like here you can see on this picture, all this part is with a changed color. So the next is with the MSP. This is with the MSP group. It's a control group. You see the K. So you see how clear the border is looking. And this is scratches from the cutting of the tooth. So I'll show you the next. Next is again from the control group, again with no micro leakage. This is with MSP. You see how it looks, very clear, but all the entire tooth was immersed in methylene blue and sealed with the silicone to avoid the micro leakage from the pulp chamber inside towards the filling. Again from the control group, there is a slightly coloration of the filling here, so we got 1+, but I told you when you see the coloration of the filling, maybe the etching procedure is done slower or faster, and the etching is not done so well. The etching procedure is very sensitive to speed, and so you have to you need a smooth sequence of impulses to get a nice surface and good etching result.
Dr. Mironov?
Yes?
There's another question that says, how did you standardize your preparation on your samples?
What standardized? About the measuring of the
How did you make them so they
size
were
of the size?
So they're very similar, so they're the same.
I worked on 3 millimeter to 3 millimeter, and I work until enamel-dentin junction, because I wanted to do the assay only in enamel, because if we go deeper in dentin, we have to analyze the QSP in enamel and also in dentin, and for now this is a pilot study and it's too large. If we go deeper, we have to do more complicated analysis, and we decided with the Professor Gutnack, because he assisted me in this, in the methodology of the experiment, we decided to work in enamel. So in some samples you see they're very small, because on the old incisors this enamel is with abrasion, but in freshly erupted incisors there's more enamel and the cavities are a little bit deeper.
Okay, great. Thank you very much.
Clear? It's clear?
Yes.
Okay. Okay, thank you. So after you will see in the time split, but on the time split I will explain more. Just now to finish the overview of the samples. Of course there are 75. We took shots from some samples which are more visible without the microscope for you. So you see now with MSP, no, it is with QSP. So we can do a flat cavity like with a turbine. With this mode, when you use 300 millijoules, it is very clear end and the bottom of the cavity. You not go too deep in the dentin, because with the 500 millijoules, sometimes if I go back, just to compare.
So one other
Yeah.
One other follow-up question to that, Dr. Frank Jung asked, is that would mean that the depth of the preparation for each of the samples would not be the same or not the same. Is that correct, or would they? How would you control the depth to make sure they were similar?
There is no measuring of the depth, but there is reaching, because you see on this slide, it's seen, there is enamel, and from here begins the dentin. So when you do preparation, you see where the dentin starts. So we not go further. We stopped on the dentin junction.
Okay, thank you.
Okay. So I just wanted to go back to this slide to show you how it goes a little bit curvy here. Preparation with too large energy with 500 millijoules. So we go again. Some conclusions about this. In a QSP mode, preparation is faster and more quieter. In the harder enamel specimens, we need more time, but with QSP is not so influenced, so low, like in high speed and MSP also. So the laser machine is not so influenced, and the time of preparation is not so slowed like in a high-speed drill, because with a high speed in the harder dentin you cannot go faster because it's too much thermal effects and you feel the smell of the burnt enamel. This first group mode is too powerful and hard to control. That's I wanted to show you some deeper zones of preparation, and I recommend to switch to 15 Hertz. When you are in QSP mode, it's very easy to switch to this, because if you're working for beginning on the 12 Hertz and you change to 15, it automatically lowers the energy to 330 millijoules, and then you adjust only 30 millijoules lower, and if you see that you are again too fast, you can lower the energy until 160, and on this energy rating it works again fast enough, but very easy to control, and smooth and very clean preparation borders. Again, about the surface modification is faster than in MSP, so we have to keep it in mind and work faster with the when we are in QSP with the handpiece to move faster and to perform efficient etching of the surface.